The member for Petrie.
Thank you, Mr Speaker. My question is to the Minister for Justice and the Minister assisting the Prime Minister on counter-terrorism. Will the Minister please update the House on how the drug ice is impacting on communities right around Australia? What more can be done to tackle this problem?
Call the Minister for Justice.
Thank you, Mr Speaker, and can I thank the member for Petrie for that question and the interest that he takes in this issue and other law enforcement issues within his electorate. Now, as members would be aware, the government has received the final report from the National Ice Task Force, and I congratulate former Chief Commissioner of Victoria Ken Lay, Professor Sally McCarthy and Professor Richard Murray for the extensive work they have done shining a light on this issue. During the course of their deliberations, they received 1,300 submissions, and they travelled all around the country, but included particularly remote and regional areas, hearing from individuals, families, community organisations, police, health workers, to get a complete picture of this epidemic. The government welcomes the report, and we are now carefully considering our response. But what is very clear to us is that there is not going to be a quick fix. This is going to be a hard grind. This is a very complex problem, and it will require attention from every level of government. It also requires a multifaceted national response led by law enforcement, but helped by measures within education and health in particular. Now, the report is very clear that Australia has an ice problem, and it's driven by three factors. There's been an increase in demand that's resulted in a significant increase in supply and, of course, much greater harm. And it's this trifecta that is feeding into this lucrative and deadly trade. We know that proportionately Australians use more ice than any other country in the world, and our dependence continues to grow. At $50 a dose in some parts of the country, it's cheaper to score a hit of ice than it is to go out for a night drinking alcohol. And during the past 3 years, we've seen a significant increase in the purity of this drug, from 19% in 2010 to 62% in 2013. Organised criminals continue to take advantage of this increase in dependency, and they are making huge profits from the lucrative nature of the ice market in Australia. Ice poses unique challenges for law enforcement, as it's both imported, we have significant importations, but it's also manufactured domestically. I will say that law enforcement has responded to this challenge magnificently. Seizures are up and arrests are up, and the weight of ice seized has grown a staggering 60 times in the past 4 years. 60 times. Arrests related to amphetamine-type drugs have increased by 88% over the past 4 years. We will continue to target supply, and we will continue to disrupt the criminals that peddle it, and this will always be the most important part of what the government does to stop the ice trade. But we must coordinate it better with education, we must coordinate it better with health, we must make sure that we increase our intelligence sharing with the states in particular, and we must make sure that we give people prevention and rehabilitation opportunities when they require it. This government has received the report. We will study it, and we're going to do all we can to tackle this national scourge.